welcome to today's episode of the Daily Blend. I am your host, AC, and we are joined in studio today by Matt Gass, who is the Missouri Market CEO of Centerstone. How are you, Matt?
Oh my gosh, friend, I am doing so good. Happy Mental Health Day.
Yes, thank you so much for being here today to kick off
Mental Health Month.
Mental Health Month. It's great. It's great. May begins Mental Health Month.
A lot of changes happening for us. I think, May being Mental Health Month and new beginnings, recovery, the sun shining, people are looking forward to some longer days, getting out and enjoying the weather. I hope when they get out and are enjoying the weather, they're seeing some changes that we've got in place. So a lot of you may have noticed that our Burrell signs are changing. And so, you're seeing a lot of Burrell signs come down, a lot of Centerstone signs come up. And maybe we just talk about that for just a little bit.
Yeah, I'd love to talk about that a little bit because we have so enjoyed having Burrell on so much, to talk so much. And I really always felt like it was important to have that mental health piece kind of woven throughout our year. And it was great having those mindful moments. So let's talk about the change from Burrell to Centerstone.
Yeah. Oh my gosh, friend, you've been such a great advocate for mental health and making sure that people are aware of what's happening in that space. For us, I've worked really hard since I've came up here in 2019 to make sure that people understood the Burrell brand. I mean, philosophically, if you saw that Burrell B, you may or may not have noticed inside the letter B were chat bubbles, right? We want to have conversations. We want to normalize mental health services. We want to make sure that people are thinking about mental health care just in the same way that they're thinking about physical health care. And that really starts with some preventative screenings, getting involved, building those mental muscles. For us, the one thing that I worry about if I was, talking about, the fears or what this may be is that people may think that, it's a different company. Yep. Or, different individuals living inside that brand. And I just want to make sure that everybody knows we're still here. I've got the world's best team. I would put our Mid-Missouri team up against any other behavioral health team in the nation. And those people are still serving. Our services aren't changing. What we're doing is not changing. We're still a Missouri company. Centerstone just gives us a lot bigger footprint and the opportunity to really look at what we did well, and then look at what our new partner in Centerstone is doing and put those things together.
Okay. All right. So people should not be alarmed when they see the Burrell signs coming down. Because I know sometimes when things change names, the first things people think, oh gosh, what's this going to mean for my mental health care, right? Is this going to change the way my mental health care is covered, the way the doctors I see, the people who have been helping to care for me? It's just the normal things. The first thing you think, what's going to change? And so I would imagine, because I know you, Matt, I would imagine that there's been lots of conversation, lots of care taken to make sure that the changes that are seen are positive ones.
Most definitely. When people think about companies coming together, forming an affiliation, merging, we usually think about the for-profit space. Centerstone is the nation's largest behavioral health nonprofit, and each state has its own board. We have board representation in Columbia, as well as Kansas City and Springfield and St. Louis and other areas across the state. So we're approaching this. My job is to make sure that everyone in Missouri has the most access to care. So if you think about the things that we were doing well in Missouri, it was, growing space for therapists to work and building our psychiatry base, having the best case management, working in our homeless populations, working along law enforcement, all of those things. The Centerstone organization, they've got some strengths that are really going to benefit us. One of those is they have a 120-person research institute. There's no one else in the nation that is analyzing, looking at data, creating what the future of behavioral health care will look. Just because we're good doesn't mean that we can't get better. And that Centerstone name matters, and the way in which they've approached research matters. They also, there's a woman by the name of Becky Stoll, and if you're in my field, you know Becky from her work, from working alongside the NFL as it relates to player suicide and players having access to, quality care. If there's a disaster, she's done disaster work in China. I mean, she sort of helped write the book as far as crisis response, and then at the national level, and now we've got access to her as part of that system. Centerstone is really proud of their military service line. They operate a number of Stephen A. Cohen clinics across the U.S. and working alongside Wounded Warrior Project, and to be able to take that competence and help bring that to our Missouri team. We've always loved and wanted to support our veterans, but this just brings a whole nother level of proficiency and sophistication within that spot. And I get the opportunity to just help connect people, right? Connect our new friends from Centerstone to those folks that used to be living and working under the Burrell sign, and then making sure that, in Columbia, making sure that those pieces of the puzzle fit together in a way that makes sense for Columbia, in the same way that my friends in St. Louis and Kansas City are working to make sure that this message gets out in their communities.
Yeah, I love that, and I'm really glad that you took the time to come in and kind of give us a little bit of background and explanation, because otherwise it's just the name change on the building, that people see, and then they have to wonder and say, oh my gosh, I wonder what happened to Burrell? Because that's generally what we say when we see a name come down. I wonder what happened. But it's nice to have you come in and say, no, this is exactly what happened, and this is exactly why this change is being made. Explanations matter.
I appreciate that. I can promise you our heart, our compassion, our dedication to communities, those things won't change at all. We're just adding some new members to the family to make things just a little bit better, a little bit stronger. I couldn't get through this conversation without mentioning 988.
Yes.
988 is the 911 of behavioral health care. It allows an individual to have direct access 24 hours a day, 7 days a week to qualified mental health professionals. And so we don't have to wonder who to call or how to make that first right step into healthcare.
Yes, and that is so very important. And I just cannot stress that enough, not just in May, but every single day of every single year. That 988 is always there for you, and it is very important. Matt, thank you so much for joining us. It was very important to me that you come over and talk to us about that change. We wanted our viewers and listeners to know. I appreciate you being here.
Oh my gosh, AC, thank you so much.